Kia ora koutou, everybody. My name's Rachel Udamapu, and it's my pleasure to be with you this afternoon delivering our Look Good, Feel Better online class. I'm actually coming to you from New Plymouth this afternoon, so we've got a reasonably pleasant day out there, and hopefully many of you, and I see some of you from beaming in from all around the country and actually even recognise some names there, Mel. And so hopefully you've all not had too bad a weekend with the weather. So welcome to our community class. Now we're just going to do a little bit of housekeeping just before we get started. So once the class starts, and I see you're all pretty much on mute, so if you could just keep on mute while we've got our guest speaker speaking, that would be really good. And we really appreciate the questions that you send through. So if you've got some burning questions that you'd like to ask our Candice, then that'd be really neat. Pop them in the chat box. So we're going to have about a 40-minute presentation, and then after that we've got probably 10 or 15 minutes for question time. So, and I know Candice has already got had some questions sent to her as well. All right, so it is my great pleasure to introduce Candice Kitt. Now, Candice specialises in cancer rehabilitation as a certified pink physio. Candice qualified lymphedema. She is a qualified lymphedema practitioner and musculoskeletal therapist. She also has a health and fitness degree. Now, Candice is going to share with us her knowledge on the importance of rehab with exercise. So, welcome. Candice is in the room. Hi, Candice. How are you?
Yeah, good. Thank you so much. And thank you everyone for being patient with me, considering I had to cancel last Sunday due to the lovely weather we were having in Northland. So I'm up here and it's not raining. So really happy to be here. So thank you so much for having me.
Fantastic, Candice. Right. Oh well, we're really looking forward to hearing all your journey and your thoughts and your knowledge. So over to you.
Perfect. Well, thank you again for having me. I do have a slide, so if you can bring that up, it would be great. Just there we go. Get that. So welcome everyone. So what we're going to discuss today is kind of exercise with oncology. So we kind of want to discuss taking simple steps of getting involved in physical activity. So people affected by cancer could be helping themselves to overcome a whole host of short and long-term physical and psychological problems. And in some cases, significantly reducing the risk of dying from the disease. So what we're going to discuss today is kind of the research and some tips and tricks to kind of back up this theory and why physical activity is the new wonder drug. So we're going to start by kind of clearing up a few myths. So we'll go to the next slide. So we've got 3 myths here. So first one, no pain, no gain. So I hear this, kind of that old philosophy, if it's not hurting, it's not working. I want you to kind of throw that out the window, especially when it comes to oncology. So doing something is better than doing nothing, and it should bring you joy. So it should not be decreasing your energy levels. It should not be giving you negative side effects. It should be giving you energy, and it should feel good. Myth 2, so exercise is worthless if I can't do it regularly for hours. So there's tons of research to show that little consistent snips of exercise is much better than hours of exercise, especially if you're going through treatment or you're recently post-treatment. Fatigue is major, and I want you to remember that we need to be giving energy rather than taking it. So if you're kind of using all that energy with what you're doing in the gym or at home or for whatever exercise you're choosing to do, if that's taking all that energy that you need for other things in the day, then it's not the best thing for you to be doing. So little snippets of exercise, even 10 minutes, is much more beneficial because you're going to get consistency from that. versus going for an hour, running yourself to the ground, and then you need 3 days to recover. So that kind of horrible yo-yo effect. So we want consistency is way better than kind of overexerting yourself. And then we got myth 3, exercise needs to be done under fluorescent lights at the gym. No. And I hate people, it's not that we're knocking gyms, because I love the gym, and I think a lot of people, they want to get out of the house, they want somewhere else to go. Great. If you want to go to the gym, fantastic, but you don't need to. And I want you to remember too, activity is exercise. So if you're just starting out, or again, fatigue is really, really challenging for you, that could be something of just getting out for a nice walk. It could be getting out to the beach, being out in nature, even doing more tasks around the house. Anything that's activity-based is exercise. And I will discuss in a little bit kind of what the research suggests as far as what we should be doing for exercise and the amount we should be doing. All right, go for that next slide. So we know that exercise is good for us, but how good is exercise for people who have been diagnosed with cancer? So this is a nice fact. I like this. There is no medication or treatment that can positively influence as many body systems as exercise can. So if we look at the next slide, so there has been lots and lots and lots of randomized controlled exercise trials looking at showing the benefit of exercise. So we know it's good for us. We know that exercise is beneficial for many, many, many reasons. But we're also seeing that 1/3 to 2/3 of people living with or beyond cancer are inactive. So we're kind of going, okay, what are the barriers? What's going on? And where can we help? So if we flip to the next slide, a bit about the research and kind of some positive things to take home as well from this. So when we look at the research, it's showing that exercise is there and can reduce the relative risk of cancer reoccurrence, cancer mortality, and all-cause mortality. So it has this lovely protective effect against cancer reoccurrence and all the things we just stated above. So really, really important. Next slide. And this is where we get into a bit of kind of what it looks like. So when we're talking about exercise, it's saying regular, moderate intensity aerobic, so brisk walking and resistance, okay, so lifting weights. During or after cancer treatment can decrease cancer-related fatigue, decrease physical conditioning, decrease psychological distress, and increase quality of life. Fantastic. What does that mean? What is regular? What is moderate intensity? So regular, remember I was talking to you about consistency. So when we look at the research, kind of the latest research that comes from the new guidelines is looking at kind of 3 sessions per week of aerobic activity. Okay, so the ideal or our gold standard is looking at 150 minutes of moderate intensity aerobic conditioning. And it's also looking at 2 sessions per week of resistance-based training. Now we're looking at moderate intensity. So what does moderate intensity look like? So if we're looking at what we call a rate of perceived exertion scale or an RPE scale, you should be able to have a conversation, but you shouldn't be able to sing a song. So if you're singing, it might be not enough intensity, but if you're puffing and can't maintain a conversation, it means you're getting into more what's called vigorous activity. So we kind of want to keep it at that moderate intensity for that aerobic conditioning. Now, when we look at resistance-based training, again, this is coming from the research, looking at multiple different types of cancer. And again, everyone is different, but I'm just giving you kind of a global of based off evidence-based research. So when we're looking at resistance-based training, we want to look more at endurance-based exercise to start. And what that looks like is kind of your 10 to 15 repetitions. So being able to perform an activity 10 to 15 times at kind of more of your lighter weights, okay? You want to be able to kind of perform that for 3 sets or building up to 3 sets. Once you're able to do that consistently without any negative side effects, so no pain during, immediately after, or the next day, for a few times in a row, you can start looking at a little bit heavier weight, and we're getting into more the 8 to 12 reps. So again, I'm being really specific, and again, this is based on more the latest research, but I also want you to remember that everyone has to start somewhere. Something is better than nothing, and activity is exercise. So it's more just finding the things that you find enjoyable and starting somewhere small and gradually building up, so we're not getting that yo-yo effect. All right, we'll go to that next slide. Okay, so kind of like I just said, avoid inactivity. Something is better than nothing. So if you are avoiding activity due to pain, stiffness, fear, any barriers that you're just feeling not confident on starting, I highly, highly recommend you talking with someone about it. Fear is massive when I'm talking with my clients about barriers to exercise. I would say it's probably one of the biggest ones, right up there with fatigue. And I think the fear behind it is doing harm and doing the wrong thing. So I think if you can take away anything from this, is I really want you to know that the research backs you up on this, and that doing something, so doing nothing is doing harm. Okay. And I'll explain in the next couple slides why that is. But doing anything is a great start, and that you're not going to do harm. We just got to make sure that it's the right starting point for you. Like I said, gradual. Yeah, we're starting, and we're going to try to avoid those yo-yo effects by doing too much to where we go, now I'm out for a few days because my fatigue is just taken over. But yes, so I really, really, really want you to kind of take that home. There are a few things that you do want to consider. So if we're looking at, low hemoglobin levels, if we're looking at extreme fatigue or anemia, so really low red cell count, those are things that you'd want to chat with your medical team about, just to make sure that it's safe. We always have to be safe. Also, too, if your immune system, so if your white blood cell count is really low, it might kind of dictate where you're doing your exercise. So especially if you're a gym goer or a community class member and that's what you really enjoy, you just want to be careful that if the immune system's too low, that it might not be the best place for you to exercise at that time. So we want to keep you safe. That's the number one goal. But there's so many different ways that we can exercise that are safe. So just, remember, doing nothing, that's more doing harm, and doing something is exactly what we want. So let's go to that next slide. So this one's a biggie. So deconditioning. So deconditioning is one of the most prevalent cancer-related treatment complications. So why that is it starts this vicious cycle. So the less you do, the less active you become, right? The less active you become, the more deconditioned you become. So that's your muscles actually starting to waste away, okay? We call it atrophy or muscle wasting. So those muscles aren't getting used. So that saying is, if we don't use it, we lose it, is true, unfortunately. And when we start getting quite deconditioned, it actually kind of stops us from doing. So the less we do, then we go to do something and we go, holy moly, that was really hard. And this is why exercise is so important, okay? So not only do we want to get back to our bigger goals as far as getting back to kind of pre-diagnosis, maybe strength or conditioning, but we want to stay really, really independent, confident, and functional, especially during treatment. So I tell clients all the time, one of my big goals for any client is to get you doing something so you can keep doing things for yourself, that you're feeling like, you can go to the letterbox, you can dress yourself, you can do your washing, you can do what you need to do confidently and feel good about it. because I think too, another big burden that I hear from clients is I'm asking a lot from my friends and family and loved ones. And people want to stay independent, but they also want to have that energy and they want to feel confident and safe. And that is the biggest thing, which I get my clients is to kind of focus on, especially if, treatments really knocked them or they are quite deconditioned, is okay, let's get you to a point where you're functional, you feel safe, you feel confident, and you feel independent in your home and in your community. So that's kind of one of the big ones. Another vicious cycle that kind of plays with deconditioning as well is fatigue. So it's kind of fatigue. I kind of explain fatigue a little bit differently than low energy. So fatigue to me, and how I explain it to my clients, is think of your cell phone. Yeah. So you got a low battery, and then all of a sudden the battery goes dead. Yeah, your battery's flat. No matter how many times you push power, that phone's not coming back on. We actually have to plug that phone into the charger and we have to give it some time to recharge. That's to me is more fatigue than low energy. It actually physically stops you in your tracks to where you have to lie down and rest. And if we can start managing that fatigue, you're going to increase your energy to have more opportunities for activity and exercise in the day. And then you get to start working your way out of that deconditioning spiral. So the more fatigue you have, the less activity you're going to do. And unfortunately, the less activity you do, we know you're going to get deconditioning and more fatigue. So we need to combat both of those so that we start getting you out of these cycles so that you're getting more energy, more muscles, and more independence back. All right, let's go to the next slide. So some lovely benefits of exercise post-treatment. So we know, exercise does so much. So improving aerobic fitness, muscle strength, so we talk about that, functional capacity, shoulder function's another big one, especially for anyone going through any mastectomies or any surgeries around the chest. Bone health, really, really important if we're on any of the hormone medications, that we're keeping good bone quality. So we want to try to, prevent or slow down osteoporosis. Body image, feeling good in your own skin, bringing up that self-esteem. And it's decreasing, so lymphedema risk, lymphedema symptoms and flare-ups, fatigue, pain, depression, and anxiety. So pretty powerful stuff. That's why we're calling it the wonder drug. So this is why I love exercise, because it's got so many amazing things. And again, that decrease in reoccurrence and non-cancer related mortality. So it's just good for us all around. And then let's go to the next slide. So being a PINK certified therapist, we work with people with any type of cancer at any stage of their treatment, diagnosis, recovery, or even years down the track. So I think Pink and Steel now cover fund classes for people. I think it's 15 years post treatment. So it's never too late to start wanting to increase your activity and your exercise and your fitness. And we do individual or group sessions. So even if I've got someone coming into one of my fitness classes, I still do a medical screen. So medical screens are really important. And anytime you would come to one of our fitness classes, you would at least get a medical screen if we're not doing one-on-one. That just gives us as therapists an opportunity to kind of get a little bit more information about you, look at your treatment-related side effects, anything going on as far as pain, limitations. Doesn't need to be necessarily cancer related. Lots of people have got back problems, neck problems, knee problems, you name it. But we need to get a better snapshot so that you're safe and that we can also potentially go, okay, maybe we're not quite ready for a group class, or this group class might be a little bit more tailored to suit your needs right now, so that we're building up to that other class. So if we turn to the next slide, I'm going to go through a couple classes that we offer. And again, it doesn't need to be a Pink and Still certified class. I know that there's classes offered through Look Good, Feel Better, even just in your community, lots of classes out there. But at least if we're getting a bit of a medical screen from a physio or from someone like your nurse or your oncologist, just to make sure that you're going to the right class to suit your needs right now. So our targeted classes are really nice classes to kind of start going into if you're just doing one-on-one with your physio, or if you're just starting to get back into some fitness. So these are really small group classes, 3 to 6 participants, and we're just doing giving you a little bit more opportunity for one-on-one, so corrections, or if we need to modify an exercise for you, we can kind of know where you're starting and work on your goals to where you want to get to. So I would say this would be a really nice starting point to kind of get into a class like this, where it's small group and you've got someone who can kind of monitor you and see how you're going, not only during class, but follow you up for how you felt after class, because that's a big one too, is you can feel really great during that exercise, and then later that day or the next day you go, holy moly, that knocked me. So we need to know that information as well. Really important. Go to the next slide. So we're jumping right into paddle-on. Now paddle-on is fantastic, really fun. Great for people just to break out of their comfort zone. So paddle-on is a 8-week stand-up paddleboarding. So a lot of research went into women post-mastectomies and looking at returning arm function. And they took, the study was with stand-up paddle boards, and they looked at kind of pre and post, and they found massive improvements in range of movement, strength, core stability. And so because of this, they are now funding this paddle-on program or stand-up paddleboarding. So it's really fun. I would say probably not the greatest one to start with if you're just getting back into exercise, but definitely one that we start to go, hey, what about? And then people go, absolutely not, but they usually sign up anyway. So if someone is approaching you and go, hey, I think you'd really like this, give it a go. It's a lot of fun. We'll go to the next one. I think this is, yeah. So next steps. So next steps is a 10-week fully funded class. So I forgot to tell you, the targeted classes are 6 weeks. So they're 6 weeks, 1-hour classes fully funded. Paddle-on is 8 weeks, but you get 2 classes per week. Pretty much fully funded. I think you pay $10 per week, which covers $5 each class, plus all your equipment, your boards, your instructor, the physio who's going, and all the equipment and instruction. Next steps, 10 weeks fully funded. So next steps is a lot of fun as well. So this is kind of a little bit more cardio based as well. It's hour classes once a week. And it's a combination of yoga, Pilates, and step. So I teach next steps in studio, but also we do an online next steps platform as well. So online next steps is for anyone across New Zealand, again, fully funded. And how it's presented is a live Zoom class each week. So you would come on just like you're doing right now. You would see me and I would guide you through a 60-minute class. It would be recorded and then you would get it sent out via email. And it's quite nice because then you end up with this library of all these different classes, so that if one week one class wasn't quite suited to fit your needs, you could go back and watch one of the other recorded classes. So at least you've got something to kind of know that, okay, I know I can do this class, but maybe we're going to start to work towards this one. And it's kind of nice because you can pause it and come in and out whenever it suits you. So that's next steps. And then if we go to that last slide there, I think that's our last one. So I like this slide. I think it's quite important that medical treatment saves lives. And you know, that I think is just so massive. And when working together with oncologists in your oncology team, it's incredible how I think our disciplines are coming together. Our professions are starting to come together now. We're communicating more and we're starting to understand not only our roles as practitioners individually, but our roles, how we're more cohesive now and how we can start working together for you at the end of the day and what's going to best serve you for all your needs. And cancer rehabilitation gives people their lives back in that we're bringing back function, we're giving you some control. I think going through treatment, there's a lot of uncertainty, there's a lot of fear, there's a lot of, you have to show up at these times, you've got a lot of appointments going on, and I want to give you some control back. I want you to know that you can do something for yourself the way you kind of want to do it and reach those goals, and know that it's safe and that it's okay and that it's promoted. And I really want you to take that home with you, because there is something for everyone and we have to do something. Okay, we have to start working on our bodies and healing and thinking a little bit more holistically. Because at the end of the day, if we can't do that run or we can't do that gym workout that we used to do right now, exercise is going to help with sleeping. Exercise is going to help with your mental state. Exercise is going to help, like I said, give you that independence, hopefully give you some confidence. And all of that is going to help with your immune system. All of that is going to help complement how you're going through your treatment, so that we keep you healthy and fit and, in a state where that you can finish your treatment, or that you can go to chemo that day and that you're not too ill and that you're not too deconditioned. So I think working together is really, really important. And I hope that you got something out of this presentation. And I would really like to open the floor up to some questions.
Fantastic. Thank you, Candice.
Not a problem.
That really resonated. Lots of even what you've been saying, and I think one of the things, talking about fear being a barrier, I can understand that would be huge for lots of people. We do have one question there that and you probably just touch on it, is what is considered inactive. And I know you were talking about doing nothing, but is there
inactive. I guess, yes, I know. Because, yes. So inactive is, I guess, kind of allowing fatigue to take over your life. And inactive is, not doing the things you kind of would do in your normal day. So, not kind of contributing and maybe making yourself food, or just kind of having people starting to do quite a lot for you, and you kind of going, yeah, I'm just feeling too tired. Or, yeah, I guess it's when you're not kind of challenging yourself a little bit to where you're currently at. So if you're just doing kind of status quo for yourself, we probably need to do more than that. Yeah. And it is really hard, isn't it? Because someone's inactive can look very different to someone else's inactive. But what we don't want is, we don't want to be doing less, we don't want to be doing any less than kind of where we're at right now, because we need to keep those muscles strong. So if you're used to being quite an active person and you've got good muscle strength, and then all of a sudden you go from being quite an active person, working, going to the gym, or not going to the gym, or just being an active person, to going less than that, you're going to start to lose muscle, and you're going to start to see changes in the body and in your energy. So not saying you have to go from kind of inactive to what you were doing, but we want to make sure that when treatment's done, we go, yay, you're done with treatment, and you had all this support when you're going through treatment. And then we go, great, go have a great life, go enjoy it. And you're going, holy moly, I don't know myself. I don't know if I can go back to work. Am I going to injure myself? I feel like I don't even have enough energy to attempt any of the things that I was doing pre-diagnosis. So we want to make sure that we're keeping you to your goals. And if that's to return to work, then we need to make sure, or whatever that is, we need to make sure that we're always kind of trying to get there, even during treatment, so that when you're done, you go, oh, perfect. off I go, versus holy moly, where do I start? Yeah.
Mm-hmm. Wonderful. Thanks, Candice. Now, there's a few questions popping up about accessing. How do I access, say, the Next Steps class or even any of the Pink and Seal classes, both online and in the main centres? So,
Yes. So I think on my last slide, I have my contact details and I've also got a link. So it's pinkandsteel.com, and you just Google Pink and Steel New Zealand. And when the page pops up on the website, you'll see at the top and I think it says rehab classes. I kind of just want to flick to it right now because I don't want to give you the wrong thing, but
okay,
so that link there, if we can click on that, I don't know if it's going to work, but let's try it out. No, okay. So if you go to pinkandsteel.com, you'll see the homepage pop up, and it'll say rehab. And if you scroll over rehab, you'll see all the different type of funding that you can get. It'll say pink, steel, targeted rehab classes, next steps, paddle on, and then you just click what one. When you click next steps and you scroll down when you're filling in your information, you'll see a little tick box and it says online. And if you click that little tick box, Pink and Steel will know that it's just for the online class. In that platform as well, you can also find a physio next to you. So if you type in if you click find a physio, you can put in your location and it'll tell you all the physios that are in your area and if they offer classes studio based.
Okay.
And then if not, then online is always an option as well.
Okay, great. Thank you. Now, there is another question here about any hints to help with poor balance post-medication. Yeah.
Yes. So I love balance. I cannot preach enough about balance. So this is, my happy place is balance. So yes, everyone should be doing balance. Every single person should be practicing balance. I think where you want to just be a little bit careful is if you're getting any neuropathies as well. So if you're getting any sensation changes in the feet, just make sure if you're going to practice balance, is obviously have a really clear area, have somewhere that's really sturdy. So a sturdy table, chair against the wall, anything. And we start with what's called your 4-point balance. So that's starting with feet together, feet semi-tandem. So one heel is in the sole of the other foot or the arch of the other foot. And then we go full tandem. Yep. And then single leg stand. All right, you want to try to hold for 10 to 15 seconds for each of those, and it'll start to tell you where your starting point is. But just remember, fingertip touch to start. If you've got it, take your fingers away and then try those out. If you can go full tandem, no problem. Challenge yourself by looking around the room or looking up. I promise you it'll get a lot harder. Single leg, start on just a flat surface, obviously next to something. Think about posture. And then see, there's other things. You can roll up a folded towel, stand on that. You can close your eyes. You can look up. There's lots and lots and lots of things to do. And yoga is usually quite good with this. So if you have, even yoga in community, or if it's appropriate for you, usually get a lot of balance with Pilates or yoga. Or sometimes there's fall prevention classes around as well. So that's what's the initiative? I think it's Live Longer for Stronger, if I can remember that, I think it's that one. And they usually can link you up with any falls prevention classes in your area as well. But that's how I would test you out, my 4-point balance. See how you go, and then start from there.
Okay, great. We've just had a comment in there as well, Candice, about lymphatic massage, and just saying that the benefits of that was fantastic, and you might want to just expand on that and comment on that for us as well.
Yeah, so I think I've done how many years on lymphatics, so we'll go really quick on it. But so the lymphatic system is incredible. Okay, so this is your immune system. This is what creates your antibodies, helps fight, anything in the body that shouldn't be there. So I'm very passionate about lymphatic system. Lymphatic massage, I do it on myself. So it's a really easy way to keep the lymphatic system quite healthy. And it's just kind of knowing where your lymph nodes are. So the main ones are in the groin, under the armpits, kind of the neck area, and behind the knees. And if you are finding that you're getting a bit of increased fluid after any treatments you've had, so any surgeries, radiation, even chemotherapy can increase fluid in the body, is we're essentially just wanting that fluid out of the periphery. So we don't want fluid pooling. We want it to go back to the heart. So if you think of your lymph nodes as your drains, we're essentially just gently stroking the skin to take it back to the drains. And then just thinking about a bathtub clogged up with hair or whatever, that fluid's not going to drain so well. So we do little sweeps, which kind of clear the drains. And then the big one that really helps as well is diaphragmatic breathing. So taking your deep breaths. You've got this massive pipe that sits under the diaphragm, and it almost surges that fluid that you've just drained from your body back to your heart. So 10 really good deep diaphragmatic breaths are going to help clear that extra fluid and bring it back to the heart. If you are struggling, if you do have any notices of fullness, heaviness, or any of those symptoms, you need to find a lymphedema therapist ASAP, because there are stages with lymphedema that we can reverse, and there's stages that we can't. So early detection is so vital. So please, if you're having anything, even contact me and I'll try to help you with anything I can to direct you. But yeah, find a lymphedema therapist, or contact your oncology team for sure, or your GP.
Wonderful. Thank you, Candice. Another question here is looking at the funding. So is it just restricted to one type of class? So if you get funding for one class, can you then get funded again to do another class, or is it just the one?
Nope. Funding's for all the classes. So usually sometimes how it happens is we kind of have a tiered system with Pink and Steel. So we see someone, especially if they're struggling or they've got a lot of side effects, we might see them for one-on-one. So you get funding for one-on-one. Then we would look at kind of taking you into a target oncology rehab class. So then we're kind of going, okay, a little less one-on-one, getting into a smaller group size. Then we would be looking at next steps, and then potentially paddle on, hopefully. So you have access to all those class funding, and it's just kind of where you're at and what's the most appropriate for your goals and your fitness level.
Wonderful. Great to hear. Our next question is about resistance training. What size weights would you start with? And do the targeted classes or next steps involve weights? So should they do resistance training?
Yes. So remember, the goal is to try to get those 2 resistance trainings per week. So soup cans are so good too. So you don't need a lot. You'll be so surprised just by getting into doing a little bit with using some soup cans. I would really, unless you just know 100% that you're beyond soup cans, but usually the people who know where they are usually don't ask the questions because they kind of are used to the gym or they're used to those type of activities. So if you're really worried about where to start, please grab some soup cans, and I want you to start there. So your bicep curls, your shoulder press, whatever's kind of feeling like you in daily life, every up stuff are grocery bags. Everyone puts something usually on a top shelf. Everyone's reaching out of their car to pull something out, your rows. So think more what you're struggling with, what kind of muscle groups you use in daily life. And if you're going, oh, I just don't know, it's just not my thing, then please contact one of us or someone in your community so that you can start getting a bit of advice and maybe developing you a little program to start, or depending if you've got a local gym, they're always a great place to go as well. Again, just giving them your background. And if you're worried about public spaces, just check with your oncology team or your GP is always kind of a good place to start as well if you're thinking about going into the community.
Okay, thank you. Now, just moving on from that one as well, have you got any thoughts around resistance exercise and lymphoma?
I don't think there's any negative, I haven't read anything with negative side effects as far as resistance-based training. Again, we got to think a little bit more holistically with resistance-based training. Resistance-based training isn't just necessarily heavy weights in a gym. Resistance-based training is thinking more about what you need to do in your day. So, do you have kids that you have to pick up? Are you going out and having to do stuff in the garden and you're lifting things? It's just resistance-based training is more to start with what activity you need to get in your daily life. And if you have other goals like, I don't know, getting back to a type of sport or getting back to weight training, then we would just tier that gradually to start kind of increasing your weights, probably like you did before your diagnosis as well. So no, there's nothing that I know of that's going to have any negative side effects to that. I think with all of them, even with what the recommendations are in that you read about or social media or whatever, we're not here to put you in a box, okay?
Sure.
And it's with anyone. It has to be individualized for you. And just because someone is going through the same treatment or has had the same surgery as you have to remember that we're all different and we all have kind of different side effects, and we're just going through a lot of different things at different stages, and it has to be more tailored to you individually and how you're feeling. So yeah.
Okay. No, that's great. Thank you. Now we have another question here. Can I do lymphatic massage if there are tumors in my neck lymph node?
That's a good question. The thing that I would say is talk with your oncology team. So the big no-nos to lymphedema and doing what's called manual lymphatic drainage when we're actually pushing the fluid is one, heart conditions, okay? Because we're starting to get an influx of fluid to the heart, we're essentially overloading a system. So that's one. And an infection, because obviously we don't want to push an infection around the body. The lymphatic system is a systemic system. So if you're ever concerned, and because I don't know you, I don't know your medical history, anything like that, I would really recommend you talk. It could be a very quick conversation and just say, hey, this is what I've heard on this podcast, that it's really beneficial. And they might just say, hey, avoid that area. Sure. And work on the other areas. But I would just clear that first. If you do have any tumors or anything like that in the lymph node area, they might just say avoid that area and go to the other areas. But please just run that through your team first.
Great. We have one more question here. Are there any precautions that a person with osteopenia needs to take when exercising?
Yes. Yeah, I think you just want to be careful about doing too much too quickly. Kind of like what I've been saying. I feel like I want to try to answer things as specifically, but it is a little bit more general. And I think it's just making sure that what you're doing is kind of less is more. So just starting to gradually build up, making sure that you feel good during, immediately after, and the next day. So if there's specific things that are going on that you are worried about, I 100% would tell all of you listening and whoever listens is just have a one-on-one, just have that first initial one-on-one. Like I said, we have funding. You get to sit with us for an hour, even if it's via Zoom, go through everything that you need to chat with us about, because it is a scary place to start something, especially if you're not used to it. And when your body feels so different to how it used to feel, this is why there's always so many questions around it, and why there's so many specific questions around it, because everyone's so different. And we really want to address to make it individualized for you. And so if you're in doubt, if you're fearful, if you're worried about doing harm, just go out for a walk until you chat with someone. Just go and do something, like I said, rather than nothing, and sit down with someone and just spend that hour and get yourself a program to start. But yeah, as far as it would just be kind of monitoring how you feel, starting small, and just remembering kind of where your baseline is. So what are you doing currently, and what would be the next step to increasing that slightly? So it's kind of that. So think about where you are, because this is what we do as therapists, is we find your baseline. So we do outcome measures to go, okay, this is what your leg strength's at. This is what your upper body strength's at. This is what your core and your balance is at. Because how can we prescribe something individual if we don't know where that baseline is? So that's kind of, if I can give you advice, sit down with yourself and go, okay, what's my baseline? What does that look like? What am I currently able to do well? And where am I struggling? And why? And if it's getting off the toilet, or if it's chairs, get it on and off the chair a few more times. Just start building, and it's as simple as that. And yeah, and if you really want to take it that next level, or you've got goals like getting back into running or all those things, then yeah, I would sit down with someone so that we can really get a true baseline to really set you up with a program that's for you.
Wonderful. Thank you, Candice. Now, I think we're actually pretty much at the end of our questions. Candice, absolutely wonderful what you've shared with us today, and I love your approach and the way in which you've delivered all this fantastic information. Now, just for everybody out there, we are going to be able to, we have been recording the session, and we can offer a link to the recording that will just last for a week, and then after that it will expire. So yeah, Candice, thank you so much. You've been absolutely wonderful, and we really appreciate it. And I know I'll give you a round of applause. I'm sure everybody's giving you a good clap from home as well. So yeah, thank you. And I know everybody would be super keen to get on the website and have a look
Yes.
at what Physio can offer, and how neat now to be able to do these sorts of things on Zoom, so that we can reach everybody, and nobody has to miss out just because of location, which is wonderful. Now,
Wonderful.
everybody, we're pretty much just about finished, but I just wanted to maybe try and redirect you back to our Look Good Feel Better website as well, and just let you know some of the other workshops that we do online. We do chair yoga, and we've got mat Pilates, which is a gentle exercise. And Candice talked about being holistic, so we also offer lunchtime mindfulness as well. So that would be another
perfect.
good session for people to get online for. We are also we have some further conversation podcasts, and of course we've got Candice on there. Her podcast is on there too, so you'll be able to hear Candice again if you would like to jump on there. So it's been a great afternoon, everybody. Thank you all for coming, and I hope you've enjoyed the session. I know I've really enjoyed listening to Candice and learned so much, and we look forward to seeing you at our other workshops later on down the track. So take care, everybody. Have a lovely Sunday afternoon.